Hi there. Welcome to week 12, medical terminology. And this week we're going to be doing chapter 14, the lymph and immune system, starting on page 548 in your book. But to get us started, some interesting facts about the lymph and immune system. The best way to strengthen your immune system is to reduce stress. There are about 50 billion white blood cells that fight disease in your blood. And less than 5 hours of sleep can weaken your immune system substantially. And also, I like this one. Studies show that people who lack humor in their lives tend to have less protective immune responses. So laugh, everybody. Dieting decreases the natural killer cell functionality, therefore weakening the immune system. Regular massages have been shown to increase the number of aggressiveness of the natural killer cells in your immune system and productive antibodies, thereby giving the immune system a boost. So something to be said about getting routine and regular massages. Even after just 1 month of quitting smoking, smokers can strengthen their immune system, experiencing an increase in immune cell activity and a decrease in the stress hormone cortisol. And again, the number one way to increase your immunity is to reduce stress. Easier said than done, I know, but very important. So if we look at the introduction, the first bold-face word you see in that introduction on 548 is lymph. And what is lymph? Well, it's a clear watery fluid that surrounds the body cells and flows in a system of lymph vessels that extend throughout the body. Lymph has a close relationship with blood, but it is different. It does not contain erythrocytes or platelets. It does, however, have two types of white blood cells circulating throughout, lymphocytes and monocytes. And that's a typo. That should be lymphocytes and monocytes. The liquid part of lymph contains water, salts, sugar, and waste of metabolism, so a lot like blood. It actually originates from the blood. Lymph is a fluid that filters out of the tiny blood vessels in the spaces between the cells, or that interstitial fluid. The fluid that surrounds the body cells is called interstitial fluid, and this is when it passes continuously into a specialized thin-walled vessel called the lymph capillaries. When it switches over from the blood into the lymph capillaries, that is when it changes from interstitial fluid to lymph. It also then flows through deposits of lymph tissue called lymph nodes to finally reach the large lymph vessels that are located in the upper chest. And if you look on page 548, they have an interstitial fluid and lymph capillaries and how they're related to each other and how they work together. So if we see the blood capillaries, then we see the tissue cells, the interstitial fluid, and then the lymph capillaries. This fluid or liquid is constantly going back and forth. And depending on where it's at, where its location, that gives rise to whether it's called interstitial fluid in the blood or lymph in the lymph and immune system. What are the lymph system functions? Well, it's a drainage system to transport needed proteins and fluid that have leaked out of the blood capillaries back into the bloodstream through the veins. Lymph vessels in the stomach also absorb lipids from the small intestine and transport them to the bloodstream to be used. The defense of the body against foreign organisms such as bacteria and viruses, and this makes up our immune system. Lymphocytes and monocytes, the two circulating cells in the lymph system, originating in the lymph nodes and organs such as the spleen and thymus gland, protect the body by producing antibodies. And these mount a cellular attack on foreign cells or by phagocytosis. Let's look at the anatomy on page 550. And we're going to label this diagram together. And this is the anatomy of the lymphatic system. Number 1 on the diagram. Are the lymph capillaries. And the capillaries are the smallest of vessels, just like the capillaries in the blood system. They're the smallest of the vessels. Number 2, so we're going to work our way, that's in the hand. Number 2 is in the arm, and those are lymph vessels. And they're compared to the veins. Number 3 are small clusters of lymph vessels where they're stationed or clumped together, and those are known as lymph nodes, and we have those throughout our body. If you look there, you see some in the arm, quite a few in the axillary or the armpit, a lot in the neck as well, and the chest, in the abdominal and pelvic cavity, in the groin, and then down in the lower extremities in the legs by the knees. So 1 are the lymph capillaries, 2 are the lymph vessels. Also, lymph vessels are compared to veins because they also have valves like veins do. 3 are the lymph nodes. 4 is indicating the cervical lymph nodes in the neck. The adenoids and tonsils are labeled for us, and those are also considered lymph nodes. Number 5 are the axillary lymph nodes in the armpit. 6 are the mediastinal lymph nodes in the center portion of the chest between the lungs. Number 11 on the diagram, or number 10 on the diagram, I'm sorry. 7 is I'm getting ahead of myself. 7 is the mesenteric lymph nodes in the intestines. 8 are the para-aortic in the lumbar region. Number 9 are the inguinal in the groin. Number 10 over on the other side is the right lymphatic duct. And 11 is the thoracic duct. The thoracic duct drains the lower body and the left side of the head, and that's number 11, whereas the right lymphatic duct drains the right side of the head and the chest, a much smaller area. Both of these carry the lymph into large veins, and that's number 12 on the diagram. In the neck, where the lymph then enters the bloodstream in the cervical area. Lymph nodes not only produce lymphocytes, but also filter lymph and trap substances from infections, inflammatory, and cancerous lesions. So if we look at page 551, that is a picture of a lymph node, which is either in the intestines or in the groin or in the armpit or in the neck or in the chest. They have the different types of cells or the lymphocytes. We have B cell and T cell lymphocytes. The B cells produce antibodies. So those are the lymphocytes specifically that makes antibodies when they're exposed to a pathogen. The T cells attack bacteria and foreign cells by recognizing a cell as foreign and destroying it. T cells also will step up and help B cells make antibodies when needed, but the B cell is the leader or the initiator of antibody production. The spleen, and on page 552, there's a picture and it's labeled for us. Letter A shows the spleen. It's located in the left upper quadrant of the abdomen, adjacent to the stomach, and you see how it's kind of shadowed out there, and you can see it. It's that purplish area sitting behind the stomach, behind and off behind it to the right. We don't need our spleen. It's not essential to life. It does have important jobs, though. It destroys those old, tired erythrocytes by the macrophages it produces. And erythrocytes, remember, live for about 120 days, and then they get tired, and new ones are formed constantly. Also, the spleen filters out microorganisms and other material from the blood. It activates lymphocytes as it filters out antigens from the blood. And also, it's a big thing because it stores blood, especially erythrocytes and platelets, when they're not needed, so we have a supply of it when it's needed for emergencies. The spleen is frequently and easily injured. It's at the level of your car steering wheel. It may cause hemorrhage when the spleen is ruptured, and immediate surgical removal is necessary. Because it stores all of the blood and the blood cells, when it's injured, we lose a lot of blood pretty quickly. After a splenectomy, and that's the removal of a spleen, no worries though, the liver, the bone marrow, and the lymph nodes take over the functions of the spleen. And they do that immediately. The thymus gland, and on page 552, that's letter B. Located in the upper mediastinum, that's the area in the chest right between the lungs. During fetal life and childhood, it is quite large. As we age, the thymus gland gets smaller. It's composed of nests of lymphoid cells resting on a connective tissue stroma sitting there in the middle of the thoracic cavity. And the thymus gland plays an important role in your ability to protect itself from disease, especially in the fetal life and early years of growth. After that, your body makes its own antibodies that it keeps on board and doesn't have to rely on the thymus gland as much. Page 553 talks about the immune system. It's the body's special defense against foreign organisms. Includes the lymphoid organs and their products, including lymphocytes and antibodies, and also macrophages. Natural immunity. If you look on the bottom of 553, the green box on the left is natural immunity. That's present at birth. It does not depend on a specific immune response or a previous contact with an infectious agent. Neutrophils, monocytes, macrophages, and natural killer cells represent the natural immunity. And there's no immunological memory. So it doesn't trigger something that it's seen before because it's always there. It doesn't have to be triggered. Acquired immunity, and that's on the purple box on the left. It develops a specific immunity to specific antigens after exposure. Acquired active immunity is something that you get after having a disease. I had chickenpox when I was 6 years old, so I am immune to chickenpox because I have the antibodies, I have the disease. Also a vaccination. I was exposed to the vaccine for the influenza virus last year, so I was immune to influenza. So when exposed to it, I didn't contract it. Another acquired active immunity is a transfer of immune cells from a stem cell transplant. And that's active immunity, acquired active. Acquired passive immunity, and that's when we don't need immediate, or that's when we do need immediate protection. We don't have the time to wait for our body to make the antibodies. So we're exposed to something and we need immediate protection. Then the patient will receive immune serum or anti-serum. And this anti-serum contains ready-made antibodies ready to fight that foreign antigen. Antitoxin given in a case of poisonous snake bite, such as a rattlesnake bite, and or rabies injections after exposure from an animal. So either way, we're immune. In acquired active, we have to make the antibodies either by having the disease or being vaccinated or getting a stem cell transplant. We still have to manufacture those into our bloodstream. Acquired passive, it's given to us immediately and immediately fights the infection. The immune response involves two major disease fighters, the B cell lymphocytes and the T cell lymphocytes. And we talked about this a little bit. The B cells are the ones that make antibodies. The T cell are the cells that gobble up the debris and attack the foreign material, but it will help the B cells if needed in making antibodies. B cell is called humoral immunity, produces antibodies in response to specific antigens, and again, originate from the bone marrow stem cells, these lymphocytes. When confronted with a specific type of antigen, it transforms into an antibody-producing cell. And this is what we call a plasma cell. And these plasma cells produce antibodies called immunoglobulins, and we talked about those last week. IgA, IgE, IgG, and IgM. IgG is the most abundant of these immunoglobulins. IgG is what gives newborns immediate natural immunity. It crosses the placenta, and it's the only one that crosses the placenta. IgG also travels in breast milk, which is why babies who are breastfed have immunity to a wealth of diseases and pathogens because mom does. Also, they travel to the site of an infection and react with and neutralize antigens while the antibodies are being produced. And that's humoral immunity by the B cells. The T cell lymphocytes are cell-mediated immunity instead of humoral. They originate from the stem cells in the bone marrow again and are processed in the thymus gland in our thoracic cavity. When confronted with an antigen, it multiplies rapidly. So the T cells multiply really rapidly and produce cells to destroy the antigen, whether it be bacteria, cancer cells, viruses, parasites. It also reacts to transplanted tissues and skin grafts. So somebody, if they have a kidney transplant or a heart transplant or a lung transplant, people have to take anti-rejection drugs to keep these T cell levels down because it's the body's natural response to see something that doesn't belong there or something foreign and to fight it. So even though it's a good thing we have a new organ because it makes us healthy, the body will fight that organ and make us sick. So anti-rejection drugs then have to be taken for the rest of the patient's life to keep the T cells calmed down because they multiply pretty quickly. Some T cells are cytotoxic, and these are the T8 cells, and these act directly on antigens to destroy them immediately. And some produce proteins called cytokines, and that aid in other cells in antigen destruction. So the T8 or the cytotoxic cells destroy or break down that antigen immediately. The other cytokines work with other cells to destroy them. Again, the T cell lymphocytes or cell mediated are what we see when we see organ rejection. If you look on the bottom of 554, a picture of the T cells, we have the cytotoxic T cells or the CD8. Helper T cells are the 4, and the suppressor T cells are the TREGs. Okay, and the T4 promotes, those are the ones that help the B cells produce antibodies when needed. The suppressor inhibits the activity of both the B and T cells. It keeps that ratio. Normally it's a ratio of helper 2 to 1 suppressor. When it's altered, disease may occur. So people with immune system disorders such as HIV have to have their T cells checked on a really routine basis. And people who've had organ transplants as well as the anti-rejection drugs. All right, I'm going to skip over immunotherapy and I'm going to look at some word parts that we're going to make cards on today. And if anybody looked ahead, you see there's not too many cards this week. And a couple of these we've had already. So let's look at page 558, immuno. Immuno is the combining form that means protection. So an autoimmune disease is a disease, and then immune is protection. Auto means self. And an autoimmune disease are actually diseases where the body attacks itself. So an example of an autoimmune disease are rheumatoid arthritis or systemic lupus. So for some reason, our body produces antibodies against our normal body tissue. Immunoglobulin is a protein that protects. And immunosuppression is the lessening or the stopping of protection. This may occur because of exposure to drugs such as corticosteroids or the results of disease, AIDS and cancer. Lympho means lymph, that clear watery fluid that once it leaves the bloodstream and enters the lymph tissues or the lymph vessels, it turns into lymph. Lymphopoiesis is the formation of lymph. And then lymphedema is swelling of the tissue due to lymph. And this is when the fluid collects within the spaces between the cells as a result of obstruction of the lymph vessels and nodes. Radiation therapy may destroy the lymph vessels and produce lymphedema. It's often, or not often, but we see it in breast cancer patients when we do radiation. If you look on the bottom of 558, the lymph nodes on the right were destroyed probably during radiation. So the vessels, the lymph fluid sits there, and we get edema, a lot of swelling due to the fluid. Lymphocytopenia is deficiency of lymph cells. And lymphocytosis is abnormal condition of the lymph cells. And lymphoid means derived from lymph organs. And lymphoid organs include the spleen and the thymus gland. Lymphadeno means lymph node or gland. Lymphadenopathy is disease of the lymph glands. And lymphadenitis is inflammation of the lymph glands. Spleno means spleen. Splenomegaly is enlargement of the spleen. Splenectomy is removal of the spleen. And asplenia means condition of no spleen. IA is condition of, A means no, none, or without. And this can be because it's been removed, they've had a splenectomy, or for some reason the baby was born without a spleen at birth. It was congenital. Hypersplenism is condition of excessive spleen. And it's a syndrome marked by splenomegaly, and that's often associated with white blood cell destruction, anemia, leukopenia, and thrombocytopenia. So the part of the spleen that is macrophages that goes and just picks up the old tired red blood cells and gets rid of the waste, it goes overboard in hypersplenism and it gobbles all the cells up. Thymo means thymus gland. A thymectomy would be removal of that thymus gland in the middle of the thoracic cavity. And I think we've had toxo for poison. If not, I apologize. Toxo is poison. So toxic would be pertaining to poison. Ana, we've had that one. It means again, anew, or up. Anaphylaxis. Phylaxis means protection. So anaphylaxis means new protection. Anaphylaxis is an unusual hypersensitivity to something that we've previously encountered. So if you're allergic to something and the first time you're exposed, you're not going to react to it. It's the subsequent or the following times that you're exposed that your body will have a really big reaction to it and protect itself by going into an anaphylactic state. Vasodilation, so blood pressure decreases, and it can be life-threatening. Inter means between. Interstitial fluid is a fluid that stands or is positioned between. Okay, interstitial means standing between something. So the interstitial fluid in the blood is the fluid surrounding or between the cells. Remember, when the interstitial fluid crosses over the capillaries into the lymph vessels, and it becomes lymph. Some pathologic conditions I want you to mark for the test is acquired immunodeficiency syndrome, or AIDS. A group of clinical signs and symptoms associated with suppression of the immune system marked by opportunistic infections, secondary neoplasm, and neurologic problems, and this is caused by the human immunodeficiency virus, or HIV. The virus is not the disease. AIDS is a disease caused by the virus. Page 560 talks about some opportunistic infections because the immune system is being depleted or being lessened. These are infections that people with full-blown AIDS can experience. Candidiasis, cryptosporidiosis, cytomegalovirus, herpes simplex, histoplasmosis, Mycobacterium avium intracellular, MAI, pneumocystis, pneumonia, toxoplasmosis, and TB or tuberculosis. These are all opportunistic infections. Kaposi sarcoma is letter A on page 561, and this is actually a cancer arising from the lining cells of capillaries that produce dark purplish nodules on the skin, and it can occur all throughout the body. Some drugs that are used to treat AIDS are inhibitors of the viral enzyme called reverse transcriptase, or RT. And letter B is wasting syndrome on page 561. And that's marked by weight loss and decrease in muscular strength, appetite, and mental activity. Page 562, mark allergy, an abnormal hypersensitivity acquired by exposure to an antigen. Again, the first time you're exposed to something, you won't react. It's subsequent exposures that there will be a reaction. Malignancies, mark lymphoma, a malignant tumor of the lymph nodes and lymph tissue. They talk about Hodgkin lymphoma is a malignant tumor of lymph tissue in the spleen and lymph nodes. The disease is characterized by lymphadenopathy, so lymph nodes get bigger. Splenomegaly, the spleen gets bigger. Fever, weakness, weight loss, and loss of appetite. Diagnosis of Hodgkin lymphoma is made by identifying the type of malignant cell, and that's a Reed-Sternberg cell named after the physicians that discovered it. And these cells are found positioned or stationed in the lymph nodes. Staging of Hodgkin lymphoma on 563, stage 1. Involvement of a single lymph node or group of nodes, and those are in the cervical area. Stage 2 is involvement of 2 or more sites on the same side of the diaphragm, so that muscular wall that separates the thoracic and abdominal cavity. So there it is in the cervical lymph nodes and also in the thoracic lymph nodes or the mediastinal lymph nodes. Stage 3 is when it's on both sides of that diaphragm. The diaphragm is kind of our mark or our lining that we differentiate between different stages. So it still only affects 2, but 1 is on the other side of the diaphragm, so it brings us to a stage 3. And then stage 4 is widespread, extra lymphatic, so a lot of lymph nodes are involved, liver, bone marrow, lung, and skin. And it's left the lymph system here and it's gone into organs and tissues. Multiple myeloma, malignant tumor of bone marrow cells. And thymoma, malignant tumor of the thymus gland. Mark that one as well. Laboratory tests on 564. Mark CD4 cell count. This measures the number of CD4 T cells, or those helper T cells, in the bloodstreams of patient with AIDS. Usually it's between 500 and 1500. If it falls below 250 to 200, it's recommended that we start with the antiretroviral drugs. ELISA is a screening test to detect anti-HIV antibodies in the bloodstream. So when we're testing somebody or we're doing HIV screening, we're looking for the antibodies, not the virus. We need to see if the patient was exposed to it. They would have the antibodies. It doesn't mean they have the virus, which is why many people can be HIV positive and never get ill with full-blown AIDS. Immunoelectrophoresis. Phoresis means to carry away with electricity. Electro and immuno is protection. And this is a test that separates immunoglobulins and carries them away. The viral load test is a measurement of the amount of the AIDS virus in the bloodstream. Some abbreviations I want you to mark are AIDS on the bottom of 565. Mark AIDS, mark CD4 cell, the helper cell, and CD8, the T cell, the cytotoxic T cell. ELISA, which is an acronym for Enzyme-Linked Immunosorbent Assay. It's a test to detect anti-HIV antibodies. And then HIV, mark that one at the bottom of that column. Page 565 on the second column, mark HSV for herpes simplex virus, KS for Kaposi sarcoma, which is the cancer of the lining of the capillaries that gives rise to those purple spots and bruising on the skin of AIDS patients. PI, protease inhibitor, it's one of those drugs that we use for AIDS patients. All right, for 567, there are 3 short clinical cases. What I'd like you to do is press pause, and I'll wait here for you. Read through the 3 paragraphs, and then all I want you to do is mark which of those 3 are the most probable diagnosis for the patient. Okay, so I'll just give you a few minutes. You can push pause. You can push pause to do the 3 case studies, and then I'll be back. Okay, I guess I didn't hit pause recording. I'm sorry. Okay, so we'll keep going. I apologize for that. Number 1, what did you put for the diagnosis of John, the 22-month-old? Yeah, acute systemic anaphylaxis. John's allergic to peanuts. Okay, number 2, Mark Scott, the 48-year-old band leader. What did you put for him? Acquired immunodeficiency syndrome. Good. And number 3, Mrs. Archer, the 55-year-old housewife who had a lot of excessive fatigue that brought her in. And that would be multiple myeloma. Okay, very good. All right, I haven't been doing the pronunciations, so we have some time tonight, so why don't I go ahead and read through the pronunciations so you know what the words sound like. It starts on page 575. I'll say the word, and you can hear it when I say it, and then if you want to, you can repeat it back, especially the words that maybe if you look at you're not quite sure how to say them. Hearing them and then saying them will kind of help cement them into your memory. So let's go ahead and start. Adaptive immunity. Adenoids. Anaphylaxis. Antibody. Antigen. Asplenia. Autoimmune disease. Axillary nodes. B cell. Cell-mediated immunity. Cervical nodes. Complement system. Cytokines. Cytotoxic T cell. Dendritic cell. Helper T cell. Humoral immunity. Hypersplenism. Immunity. Immunoglobulins. Immunosuppression. Immunotherapy. inguinal node, interferons, interleukins, interstitial fluid, lymph, lymphadenitis, lymphadenopathy, lymph capillaries, lymphedema, lymph node, lymphocytes, lymphocytosis, lymphocytopenia, lymphoid organs, lymphopoiesis, lymph vessel, macrophage, mediastinal nodes, mesenteric nodes, monoclonal antibody, natural immunity, para-aortic nodes, plasma cell, right lymphatic duct, spleen, splenectomy, splenomegaly, suppressor T cell, thoracic duct, thymectomy, thymus gland, tolerance, tonsils, toxic, toxin, vaccination, vaccine, acquired immunodeficiency syndrome, allergen, allergy, atopy, CD4 positive cell, ELISA, Hodgkin lymphoma, human immunodeficiency virus, immunoelectrophoresis, Kaposi sarcoma, lymphoma, multiple myeloma, non-Hodgkin lymphoma, opportunistic infection, protease inhibitors, reverse transcriptase inhibitors, severe combined immunodeficiency disease, thymoma, viral load test, wasting syndrome, Western blot. Okay, so we have one more chapter done. Go ahead and make your cards if you haven't already. Go ahead and read through the rest of the exercises. I think it's A through I or A through J for this unit. And we'll test then next week. I hope things are going well, and thank you for your time.